welcome to the Stepped Up Nurse Studios and the Stepped Up Nurse podcast. I'm really excited to be here, and I believe you are also excited to be here. So today in the studio, we are going to be having an amazing personality on board, Nurse Christiana. She's going to be sharing with us her experience as a nurse. She's going to be comparing with us. We'll be doing a comparison of old-time nursing and the new age nursing. Trust me, I am in between. I'm like Jesus Christ, the mediator between the old and the new. Nothing I never hear for this profession. You know, the young people will come and meet me and say, no, sorry, me, I don't like this one, I don't like this one. I'll be like, guy, calm down now. I understand. But the old people too will come and say, I don't like the way these young people are behaving. Why is it that they don't respect people? Why is it that they don't do this one, they don't do this one? Me, I'll not be in the middle, I'll be settling fights. So this is it. We are going to be hearing from an amazing nurse. I know if as you're looking at that, you'll be like, this woman is not old though. Don't come and don't bubble me nurse only. So she'll be sharing with us from years of experience, trust me. And I believe that she'll be sharing with us a balanced view about how things go. Yes, I'll give her the floor to speak, but I want you to watch this video. I believe that this video will be beneficial for nurses and for young nurses, for older nurses, and for people that want to step into the profession. Please listen with insight and try and understand where these discussions are coming from. Also try and internalize part of the things that she'll be sharing, because it may go a long way to make a difference in your practice, your everyday practice, right? So thank you so much, Mom C. Okay, I think I have other Mom C. So I've been, by God's grace, able to mentor and coach people that are older than I am, and trust me, some nurses are really humble. I celebrate God in your life, ma'am. And I'm really happy to have you in the studio today. So kindly introduce yourself, ma.
Thank you very much. My name is Christiana Oluwakemi Adeniji. I am a nurse.
Welcome, ma'am.
I'll forever be a nurse.
Is there more you want to say? I know there is more. Okay, share with us how many units have you worked in that you can remember since you started working as a nurse? Like, what departments, what different units have you worked in so far?
Yeah, thank you very much. I've worked in the pediatrics units, that is the children wards. I've worked in the obs and gynae, labor wards for few periods, and I've worked in cancer ward.
Wow, cancer. Wow.
Yeah.
Wow. For how long did you work in the cancer ward? Oncology ward, right?
Yes, not for a long period of time. Yes, I work in that was in Lagos University Teaching Hospital, LUT.
Okay.
And
did you work there for up to a year?
In LUT? Yes.
Yes, in the oncology ward, right?
No, I didn't work for up to a year before I moved.
Okay.
Actually, I ran away from LUT.
Wow.
The work in LUT is killing.
Oh my God.
Yes.
Oh my God.
On your toe all day throughout your shift.
Okay, before you went to LUT, where were you working?
Yes, I work in a private hospital. That's hospital
for some years, right?
Yes. Then when I left LUT, I started working with University of Lagos Medical Center.
Okay, University of Lagos Medical Center. What kind of patients do they admit there in that medical center?
We attend to the staff. That is, yes, it's an academic environment. The staff, the students, then relatives. Then if there is any emergency, nearby the university environment outside, they can rush them in. We give first aid before referring to LUTH or FMC or last whichever one.
Okay. Did you have much experience with the younger generation of nurses when you were working?
Younger generation.
Like maybe you were the older nurse and the younger nurses were employed and they had to work with you.
Yes.
That kind of thing, or student nurses. Have you had such an experience before your journey?
Yes, I had experience with student nurses when I was in LUTH.
Okay.
Yeah.
Okay, was it an amazing one? Did you gain insight from your experience, or was it something you didn't really enjoy in your journey when you were working there?
Really, I enjoy working with student nurses because I enjoy working with those people that are still learning. I'm always ready to give assistance, especially when they come to the ward for exams, training, clinical trainings. Even the doctors, when they come for exams, there are some flaws that they will have fallen into, but I'll be willing to just fill in the gap for them.
Oh, that's really amazing.
You know, you are the one.
Can you share with us some of these instances?
Yes. You know, you are the one working on the ward. You know the ward, you know your patients. Let me tell you the one on the children department, that is the pediatrics. You know, children, if they are not familiar with you, they will never relate with you. And anyone that is going to deal with children, we have to be very patient and you have to observe them very well. When student nurses come to the ward for exam, in pediatrics, I will tell them, if you need an assistance, just call me. Call me, because I know the children will not cooperate with them. They will not. Even the doctors, there was a time that I think the senior doctors, they were about to be promoted. So they have some consultants, not even from LUTH alone, from IFE, from UI. So this doctor has to attend to a child. I can't remember whether it's a girl or a boy. Yeah. When the examiners arrived, the child was just crying and crying. The mother couldn't pacify the child. The consultants, they stood there, they were looking at the doctor, because he should tell us that you have been coming to this ward to work. Then you should have known your patients. I arrived at the scene and I saw the child. I was just looking at the doctor. He was even perplexed. He was nervous. I said, God, what can I do to help this man out?
Yeah.
I went to them. I said, you guys are not good. What are you doing to my boy? I don't like it. Mommy, and you are there. You two, you can't do anything. I talked to them one by one. So all of them were looking at me. I now faced the boy. I said, come. What is the problem?
The person doing the exam, right?
No, I talked to him. I talked to the consultant one by one. You guys are not good. What are you doing? You. And I faced the patient. I said, what is it? Who among them? Who beats you? He was looking at me. Tell me the person. Is it this man? I was trying to distract them. What happened? Mommy? Is it mommy? And I remember that I had a sausage in my bag. And I brought the sausage out. I said, do you want this?
Yeah, take.
He said yes. I gave it to him. He kept quiet. So when he kept quiet. And
that's how the person started his exam.
Yes. When he kept quiet, I said, hey, I'm going to leave now. I must not hear anybody terrorize this boy. I just left. After the exam, the doctor, he didn't even know whether to carry me out. He said, madam, thank you. Thank you.
This is really interesting.
There was another case.
But couldn't they have moved to another patient?
Another case of a doctor.
doctor. Please shoot
Yes.
you, and now you go edit too.
Continue.
Okay.
Yes, there's another case of another doctor on examination on the ward, the same children ward. So
Okay.
it was to do assessments on a child. So he wanted to weigh the baby. I think the child is maybe it's a crawler, crawling one. Yeah, it's not up to a toddler. So he's going to weigh the baby. So he put the baby in the weighing scale, on the weighing scale with the Pampers. Oh my God! Immediately I cited that. I quickly went to him. I said, please place this baby very well. I don't want the consultant to understand what I want to do. I said, please place this baby very well. I quickly removed the Pampers. The diapers.
Okay, you shared with us about medical doctors. What about nurses? Have you been able to be of help to student nurses like this?
Yes, yes. I quickly removed the diaper. He said, the consultant said, sister, no. I said, it's hurting the baby. It's not placing the baby where I just want to adjust. He wanted to check the temperature. He put the thermometer the other way around. I quickly removed it and replaced it again. I passed. I said, I'm taking care of my patients. That is what I told them.
That's interesting.
In the case of the student,
he got the rest correctly.
Yes. After the exam, he came back to thank me. He said, sister, thank you very much. I said, what are we here for? And what I do is that.
That's so nice.
What I do is that anytime
there's share with us about student nurses.
Yes, anytime there's an examination on that ward and I'm on duty, I'm always observant to see anywhere I can be of help to the students. The case of
this is a lesson to all elderly nurses that experienced nurses on the ward, that they'll just say, leave him. Shebi he thinks he knows everything. Leave her now. Shebi she want to show me that she has sense. Don't worry, we'll be here together. When you finish failing this exam, you come and tell me. This is actually a lesson to our elderly nurses. We can actually do better. We can do better. We can help to shape the future and make everything balanced. And there's no point having that person lose or fail that exam. No, there's no point. At the end of the day, it's you that will be celebrated. So, Ma, share with us, what has it been like comparing the new nurses and the older folks? What has it been like? How has the relationship been? And what have you been able to do to help the situation? Like, we know that there's always a rifts between, agreement between the older nurses and the younger nurses. What has it been like?
Yes, thank you very much. What I noticed in that area is individual differences in psychology. Is the personality of the person you are dealing with. Yes. And in the area of the young nurses, you are asking me, did I give any assistance to the student nurses? There was a day the student nurses too on the ward to have I think they were to do a bed bath for a boy. But fortunately, the boy's mom has left the ward. I think she has gone to work. So the boy was left with the house help or so. And this boy has been a very troublesome boy. He said, don't touch me. This one, don't touch me. And he sat on the bed there. Don't touch me. Nobody should touch me. I was looking at these student nurses. I said, God, how can I help these girls? How am I going to come in? The examiner. As God will have it, there was a quarrel among the mothers. So the examiner just step aside to see what is happening. And I went to the boy.
So you quickly?
Yes. I told the nurses, I said, just calm down. You people should calm down and relax. And I asked the boy, what is the problem? What exactly do you want? He said, no. I said, tell me. I know you want to write. I have blue biro, red biro, all set to my, and I said, do you want this colored one, this red biro to write something? He said yes. I gave him the biro. I said, give him the book. I said yes. Allow these aunties to do what they want to do to you. These aunties, they want to play you, okay? And I just left them. So by the time the examiner came back, they have started what they want to do. After the exam, they were so happy. They said, thank you, sister. I said, what are we here for? We are here to help everyone.
That was the age when they were still doing practicals. I hear that they are no more doing practicals in nursing.
Yes,
they are now
everything
doing
is...
OSCE and CBT, and I'm like, how will these people really learn the practicals associated with this profession? I don't know what is it that can be done to bring back this to bring a coherence in the old time nursing and the present generation nursing.
The issue of CBT and OSCE, I think it starts to do with people that want to relocate from their nation to another, probably to the Western world.
No, it's now the examination system. That's the present system they are using to examine now. Yeah. In some institutions, they are transitioning to that CBT. There are some schools here where I stay that they now do CBT. They don't do practical like that anymore. Then they do OSCE, right? Compared to before, that you would see the patient, you would bet the patient like, so just a few months ago, I was hearing about this transition.
You even do wound dressing.
Yes, you do wound dressing, and
you even do wound dressing. They will observe you dress a wound aseptically.
Yes. Exactly, and that really went a long way to help us. Preparing for that exam will make you master those procedures one by one. You will take your time to master them. Thank you so much, ma. Yeah, you are very correct, ma. Thank you so much for sharing with us today. God bless you, ma. I believe that we'll still have you on this session in the future. I believe so very much. Thank you so much for your time, ma. And I believe that we have learned something from this video today. If you are a nurse or you are planning to come into the nursing profession, please, I need you to bear these things in mind and go forward with it, because these things will help you. Communication is very important. Maturity is very important, and this competitiveness, it will continue to affect us if we carry on with this. It's time to show love and empathy and work together for the progression of the healthcare system. Thank you so much for watching this video. Please do well to share with your friends and subscribe to our YouTube channel. Thank you so much. See you in the next video.